So welcome everyone. This is our May 21st edition of Ask the Dietitian. I'm inside the Cancer Wellness Center. I'm in our Tai Chi room and I'm like surrounded by all this beautiful natural light. It's so great to see everyone today. I am just going to quickly introduce myself, but then we got to get started. So my name is Lori Bombacco. I'm an oncology dietitian and I work here at the center and have several responsibilities. I run programs like this one today, as well as our wonderful Mind Body Longevity Kitchen series. And I co-facilitate weight loss for wellness, but I'm also available to meet with one-on-one for nutrition consults. So if you're interested in any of those services, please just contact us. Chances are you'll be eligible and I'd love to be able to help. So in our program today, we had actually an unprecedented number of questions that were submitted. Okay, so I have about a half an hour to try to get through all of those questions and to give you some helpful information. Today is all about bone health and why that's relevant for our survivors and what can we do? How can we harness the power of nutrition really to optimize bone health? So without further ado, I'm going to share my PowerPoint presentation. And for all of you who have joined and are in participation and registered for the program, then you will get a copy of these slides after the program. Okay, so without further ado, I shall share my PowerPoint. Welcome to Ask the Dietitian. So this is all about nutrition and bone health. One moment, thanks. Okay, so here are the questions that were submitted. If bones are being weakened by estrogen blocking treatment, are there ways to nutritionally strengthen our bones? Osteoporosis and anastrozole. How do we eat better if those are two of our concerns? The next question sort of coincides with this one, so I'm going to call it 2A. And so this question reads, after 4 years on an aromatase inhibitor after breast cancer, I've developed some osteopenia. Other than walking every day and using armbands, what should I be doing? And my internist advises no calcium pills. Thank you, or thanks. You are welcome. So this internist advised no calcium pills. I want to talk about that towards the end. So I won't address it when I answer this question at that time, but in a later slide, I'm going to address that. The third question, are there foods we should avoid or limit in order to maintain bone health? And besides exercise, how does diet enhance bone density and health? 3A, it's a very similar question. What are the best foods to eat for healthy bones? The fourth question, my oncologist has recommended that I get infusions of Zometa to strengthen my bones. Can you recommend food and supplements that can also help? A similar question, but not quite. Are there any supplements that you recommend? And the last question, last but not least, is there a problem, any problem to the bone density for drinking coffee every day? And how much can I drink in a day? All of these questions are fantastic and I can't wait to try to get to them. But first, I want to just briefly discuss bone health and why are we here to talk about bone health? So I don't know if you knew this, but bones are they're living tissue and they're constantly building and breaking down. And so this is sort of a balance that we find. And early on in life, young, healthy bones have really the optimal balance of building bone and minimal breakage or loss of bone. But starting at the ripe old age of 30, we start to lose bone faster than we're actually making it. And what happens is this compromises the bone, right? It causes sort of a deterioration of those living tissues. And it then disrupts the structure and the function of the bones. And that could lead to possible breakage of the bone. So we see two conditions that can result as a consequence of the weakening of bones. And the first is osteopenia. And so this is really characterized by minor loss of bone mass. And it's sort of regarded as like the pre-osteoporosis condition. Now, if that accelerates and progresses, that will eventually turn into bone disease or osteoporosis. And the word osteoporosis essentially means porous bones. So this is an image, as you see here, on the left of a healthy bone tissue, while on the right, this is someone who has osteoporosis. And so some people describe it like a honeycomb look in appearance. And so you can see where that structure is really compromised there. Now, the information I'm about to present really is just that, information. So if you are concerned about your bone health, please discuss this all with your healthcare provider. You should know what your specific plan should be with regard to your bone health. So let's go to those questions. The first one, I don't know if you remember it, there were a lot. If bones are being weakened by estrogen blocking treatment, are there ways to nutritionally strengthen bones? So I just want to talk quickly about estrogen blocking treatment and what does that have to do? Some of you may be familiar, but some of you may not be. There are cancers that are hormone sensitive, meaning that the mechanism of the carcinogenic process of those cancers are dependent upon hormones that naturally occur in our body. And those include breast, prostate, as well as ovarian and uterine cancers. And their treatment then tries to exploit that mechanism to kind of get to those hormones and to change the balance of the hormones so that it doesn't lead to the carcinogenic process. Now, one of the types of treatments used are called SERM, or selective estrogen receptor modulators, and tamoxifen is one of them. And what tamoxifen does is it blocks estrogen receptors so that estrogen cannot attach to them. It sort of like locks the door and then throws away the key. But with SERMs, like tamoxifen, there's not really a loss of estrogen in the body. Another type of treatment used in hormone-sensitive cancers is aromatase inhibitors. And an example is anastrozole. And someone asked the question because she is on anastrozole. The way that aromatase inhibitors work are that they block the conversion of androgen to estrogen. So with aromatase inhibitors, there is a loss of estrogen in the body. And the last treatment I want to discuss that is used for hormone-sensitive cancers is luteinizing hormone-releasing hormone agonists. And so the examples are there on the slide. I'm not going to read through them, but the way that they work is that they lower the levels of testosterone in our body, and they also reduce the production of estrogen in our ovaries. So another example of how a drug can lower estrogen in the body. And when we lose estrogen, what happens is our bones are compromised as a result. So what we have found in the research is that aromatase inhibitors, as well as the LHRHs, can lead to the loss of bone and increase the risk of osteoporosis. Now I'm going to answer the next part of that question as part of the next few questions that I've kind of lumped together because they were similar. So the questions are osteoporosis and anastrozole, how to eat better. Again, about that aromatase inhibitor, there's some osteopenia. What can I do? And is there exercise? Is there a lifestyle approach? And what about those calcium pills? I'm going to talk about that. Are there foods we should avoid or limit in order to maintain bone health? What are the best foods to eat? So let's talk about that. But as a holistic dietitian, I want to start first with an overall lifestyle approach. And what is advised is that if anyone is smoking, that they try to quit. We see that this is definitely a contributing factor to compromised bone health, bone density. Same goes for alcohol. Alcohol, what happens when it's consumed in excess, it can inhibit the metabolism of some very important nutrients that matter for our bone health. It is advised to exercise regularly, and I've listed some examples, but I'm going to, in the next slide, present additional good examples if you're concerned about your bone health. And then, of course, we want to think about diet, right? Food is sort of an important tool in the toolbox. So let's go to those bone strengthening exercises. I took this right from the National Osteoporosis Foundation website. And you can see they're listed. They recommend several forms of weight-bearing exercise. The first is high impact versus low impact. So if you have osteoporosis or frail easily, you might want to use these low impact exercises. So you want to get clearance from your physician first. Otherwise, if you do not, we want to try to include some of these high impact weight-bearing exercises. I love the dancing and the jump rope going for a jog or a light jog, all really important for bone health. But then too, we want to add in some muscle strengthening exercises. So you see listed there under number 3 to do these a couple times a week. And so that might include things like weightlifting or yoga, as well as those exercise bands that were included in the question. You know, if you're interested in any of these, please check out Cancer Wellness Center because we have a lot of wonderful programs, including yoga, that you can consider. Okay, so now on to the good stuff. How do we feed our bones? Well, really, the first step is to think about your overall diet. And that's sort of the theme for today that I'm gonna come back to. We wanna eat enough protein. As it turns out, protein is a component of bone. And really, it matters in terms of maintaining bone strength and flexibility. And not only is it important for bone health, but it also is important for our muscular health. So it helps to synthesize and repair muscle. So we want to have just the right amount. And generally for most women, that's 60 grams. And for men, that's 80 grams of protein. But if you're looking for something more specific, you could take your weight in pounds and divide it in half. And that's about the number of grams of protein you require every day. It is advised to try to consume 10 servings of fruits and vegetables every day. Don't worry so much because a serving's not that big. A serving would be a half a cup. And for your reference, I love the idea of using a female fist. So half of a female fist is half a cup. So then it kind of puts things in perspective. Okay, that's a half a serving of vegetables. I can do that. Right. So if you're starting with maybe 2 servings a day, try to think about how you can get 1 serving closer, every day or every week, according to what you can do. And then lastly, we want to also consider today, which I'm going to spend the next few slides discussing, these bone building nutrients and why do they matter for our bone health. So here they are listed, bone health and the micronutrients that are required in their maintenance. Some of them you might be familiar with, right? Calcium, vitamin D, like those are always, they come to mind. But there's other vitamins and minerals on the list too. And we need just the right amount of them. That prefix micro in the word micronutrients is there for a reason. We only actually need small amounts, but we do need enough. And where do we get enough? Is it in those capsules and pills and powders? Not so fast. As a dietitian, I'm always going to advise food first because that's where we know we have superior nutrition. So what I'd like to do is just present each of those quickly and then go through the top food sources of each of those micronutrients. So we'll start with our famous calcium. So we're required to get 1,000 to 1,200 milligrams of calcium every day. And most of the calcium that's in our body is in our skeletal system. 99% of it is in our skeletal system, the bones and the teeth. And really it helps to maintain structure and support of our bones. Now, some of these choices you're probably guessing, yeah, they make sense, are dairy. Dairy is where we get calcium. And let's see how much they provide. And that may or may not surprise you, but you can see how pretty quickly some of these choices add up to your goal. But we don't always need to have dairy to get calcium. So I wanted to show you some plant-based choices of calcium and how much they contain. Now we want to look at labels as it relates to alternatives. So if we're doing a dairy alternative, whether it be a yogurt or a drink, we want to see, is there calcium that has been added to the product? And all that requires is that we look at the food label. And that's where I can be helpful. We also see other products like tofu and cereal are fortified with calcium, but they're not all created equal. So again, whichever one you'd like to decide, you just have to pick up that label and review. Next up, vitamin D. We are required to have 600 to 800 international units of vitamin D per day. And I want you to think of vitamin D as being like calcium's sidekick. It sort of helps us absorb calcium better, but it also is involved with balance. And so they test balance by putting someone on a platform and they see how much they sway. And if you have a vitamin D insufficiency or deficiency, it affects negatively your balance. Now here's where we find vitamin D in food. And here's how much it contains. So you might be noticing, okay, if I don't have salmon regularly, that's not a lot of vitamin D, and you're spot on. We actually don't find vitamin D very high in the foods that we eat. And so it's regarded as shortfall nutrient, meaning Americans do not eat enough vitamin D. Well, good news, we actually can synthesize vitamin D from the sunshine, but the problem is we don't do that year round. Okay, so on this map, you see this is in November, the monthly total of UVB light affecting each region of the country. And starting in, I would say even late October, but November through the late spring, this line from LA to Atlanta does not satisfy our requirements for vitamin D synthesis, because as you see here, the UVB light is just not strong enough. So during that time of year, chances are we are not achieving our goal level for vitamin D. And just something else to point out about vitamin D, these variables also will reduce your chances of making the vitamin D from the sun. So if you're someone who puts on a lot of sunscreen, covers up, doesn't go out during the day, chances are you might also, even during this time of year, not be making enough vitamin D. Let's go back to our micronutrients. So this is my favorite one, magnesium. And we need about 300 to 420 milligrams per day. Here are the foods that we find magnesium in. Magnesium has a lot of responsibilities, but mostly it sort of maintains the cells of our bone tissue. So it maintains how they function, how they operate. It has a ton of other functions, and that's why magnesium is a really important one to consider in your diet. So here's the amounts of magnesium that we find in those foods listed. And as it turns out, magnesium is also a shortfall nutrient. So we are not eating enough magnesium in the American diet. Next up, another one of my favorites, potassium. This is a mineral that also has responsibilities for maintaining the structure of bone. And we've required 2,600 to 3,400 milligrams per day. Here's where we find magnesium, more plant food choices if you haven't noticed. And here's how much they contain. So potassium is also a shortfall nutrient. So surveys of the American diet indicate that we are not consuming enough of this really important mineral. Next up is vitamin C. We require 75 to 90 milligrams of vitamin C per day. Vitamin C helps make collagen, and collagen is sort of the foundation of what bone is. So here's where we find vitamin C, and here's how much those choices contain. Hopefully you've noticed that there's a good amount of vitamin C in these foods. And actually vitamin C is not a shortfall nutrient. We're eating plenty of vitamin C in our diet. And then lastly, vitamin K. So we require 90 to 120 micrograms of vitamin K per day. There's 11 different types of vitamin K. There's one type that we eat in food, and then 10 different types that we make in our body. Our bacteria in our gut actually makes vitamin K. So the food form of vitamin K you see listed there on the slide, a lot of greens, more plant choices. And here's how much they supply. So again, a really high amount, sort of like vitamin C. It seems like we're eating plenty of vitamin K, and surveys show that's the truth. A deficiency of vitamin K is very rare in this country. Now I want to talk a little bit, I mentioned the things to eat. I want to focus on something that is of a concern for bone health, and that's soda, but specifically cola. And it might be because it contains phosphoric acid as well as caffeine, as well as some other additives. And this combination is potentially associated with bone loss. But it probably is a matter of imbalance. That's what the experts say, that we're taking in too much of this phosphoric acid and caffeine found in cola, and not enough of the other really important bone building nutrients. So think of that. Another way to think about it is someone drinking too much cola probably isn't eating a lot of healthy stuff. So it's a matter of balance there. But the experts, if you're looking for guidance, they suggest no more than 5 colas per week, and then really to try to include those bone building nutrients. So here's the bottom line about bone building nutrients. Your calcium goal seems to matter, right? So 1,000 to 1,200 milligrams per day. If you click on this link, it's going to bring you to this really great calculator. So you can estimate how much calcium you're eating in a day. Vitamin D goals also matter, 600 to 800 international units per day. We can have blood work done to see what your levels are. Are you insufficient or deficient, or do you have adequate levels, and do you need a supplement? I would also encourage those of you listening to focus on shortfall nutrients. So I've listed the ones to consider and how to incorporate those foods every day, because those nutrients are relevant for bone health, but many other health properties in our body. And this link is another one of my favorites. It lets you evaluate how healthy your diet is. So overall, you can click on this link and see how close you are to goals. Okay, the fourth question. My oncologist has recommended that I get Zometa to strengthen my bones. Can you recommend foods and supplements that can help? Okay, so Zometa is a supportive prescription, and it's given to treat symptoms of cancer, including high calcium levels in the blood, as well as decreasing some of the complications that might be produced by a bone metastasis. So I underline and put in italics high calcium, because we want to then know how much calcium someone is taking in, or if they're taking a supplement of calcium. So you need to know that, all right? That would be something to talk to your physician about. What are my calcium levels, and what are my goals then based on those levels? Because it wouldn't be appropriate to add a lot of calcium if your levels are tending to be high. So what then is the bottom line with Zometa and bone health? I would say, just like I presented the few slides earlier about bone building nutrients, I would try to incorporate those as much as possible, right, through food forms, because that's not going to push your levels off, but it's actually going to satisfy your requirements for your total bone health. I think a great point to make is to emphasize that whole food plant-based diet. And I almost always use this analogy, like this image of a plate, and how to design a plate at meals so that you can eat a plant-based diet. It would look like this. You ready? So most of the plate would be occupied by non-starchy vegetables. So if we think about those shortfall nutrients, I saw spinach on there a lot. So maybe we would make sure spinach is on this side of the plate as much as possible. But you see a ton of other great options for veggies. And then the remaining quarter of the whole plate would be for whole grains, something like quinoa. And then the quarter of the whole plate could be for a quality protein like salmon for some vitamin D, or it could be for plant-based choices like black-eyed peas or black beans. You saw were a great choice for some bone-building nutrients. Now, this slide is probably the most important one that I present to you as it relates to bone health and nutrition. It's really all about this balancing act. So the idea is we want to increase those nutrients and those foods that really saturate our body with the nutrients that are essential for bone health. They are fruits and vegetables. All right, fruit and vegetables. So chances are you're not eating recommended amounts. So how can you incorporate just a little bit more every day? And think about a whole food plant-based diet as close as you can get to that as possible. What that does is that actually alkalinizes our body. And this is a great way actually to maintain the mineralization and the density of our bones. At the same time, we want to decrease the very things that may create a more acidic environment in the body. And we find that those are the highly processed foods. So refined grains like white rice or pasta, excess salt. So recommendations are 2,300 milligrams per day. Most of us are eating close to double that amount. And then also added sugars. So what happens is all of these things sort of negatively impact the way we metabolize those bone building nutrients, and they replace those healthy foods very often. So we want to just try to minimize them as much as possible. Okay, the fifth question, are there any supplements that you recommend? Great question. So dietary supplements and bone health. Again, if you're thinking of taking any supplements or you currently are, please talk to your healthcare provider. We want to just make sure it's safe and it's not interacting with anything that you're taking treatment-wise. The operative word is supplement. Right? So dietary supplements really are meant to supplement the diet. We get maximum nutrition from food. and no supplement will ever come close to that. And I like to use the analogy of the Goldilocks effect. So as it relates to our micronutrients that we need in very small amounts, we just need the right amount. So think about Goldilocks, right? When she was eating the porridge, she tested the different porridges out and she found the one that was just right. And that's what matters for bone health. So too little, it could be detrimental for bone health, and too much could also be detrimental for bone health. So we need just the right amount. And really that depends on the individual. And that's where a dietitian can help. Also, your healthcare provider could give you some goals. So far, as it relates to bone health and dietary supplements, the evidence is mixed. So you'll see a lot of products on the market like bone health or bone supportive products. What we only see is that for calcium and vitamin D, there is a benefit. Okay, all the other vitamins and minerals have mixed results. We can't definitively say they should be used. So calcium in supplemental form has been shown to lower bone turnover rate. And so that's a measure of bone loss. But when it's paired with its sidekick, vitamin D, it has been shown to lower risk of hip fractures. And that seems to matter highly, right? So this has been found especially helpful for women who are beyond 5 years of their menopause. Okay, so if this is someone that sounds like you, it's worth discussing with your healthcare provider. Now, remember, there was part of that question. My internist said, no calcium pills. And I get asked this question every so often, so I thought I would discuss it in a slide today. So should we be supplementing with calcium or not? Where does that even come from? So in 2008, there was a research study that suggested calcium increased the risk for heart attacks. That's a concern, right? I wouldn't want to take calcium supplements then. Now, 2008, that's a long time ago in nutrition research. That's actually antiquated information. And since that time, in 2015, there was a meta-analysis that was published that took all the clinical trials, so really good studies, not just one. And it found that women that were taking from 600 to 1,500 milligrams of calcium, it did not cause heart attacks for them. So calcium supplements have sort of been vindicated, okay? Based on the available evidence to date, and this is as per the National Institutes of Health, calcium intake from food and supplements that does not exceed the upper limit should be considered safe from a cardiovascular standpoint. So what is that upper limit? 2,000 milligrams. Okay, so that's the upper limit that is advised by the experts, but some clinicians will set that limit at 1,500 because of what that meta-analysis showed. So as it relates to these dietary supplements, let's start then with calcium. There's two main types, calcium carbonate and calcium citrate. That carbonate is best taken along with food, whereas citrate you can take with or without food. It's better absorbed even without food. Absorption is highest in doses that are less than or equal to 500 milligrams. So don't think if you take a big whopping dose all at once, you're going to absorb all of it. 500 is the max dose. And then as for vitamin D supplements, there's also two different types. We have D2, which is ergocalciferol, and that's a plant source of vitamin D. And then we have cholecalciferol, D3, which is from an animal source. Now I put that on there because a lot of times I hear questions, one is better than the other, and that's not necessarily true. Both forms of vitamin D are absorbed similarly. However, we do see that vitamin D3 most often is efficacious in increasing those blood levels to a greater extent. So if someone's deficient, they may be prescribed D3. It seems to maintain those higher levels longer as well. Vitamin D supplements are advised to take with food. And if that food could have some fat in it, it also facilitates absorption. So I've listed some healthy fats there on the slide. Now, here are some resources. Again, we'll bring you right to those websites if you click on the link about dietary supplements. Very helpful for me. And the bottom line is about supplements is discuss with your medical team. If you're interested or if you're taking any, please just let them know so you could be advised safely. And think about, can you add foods that include those targeted bone building nutrients? And especially keep in mind those shortfall nutrients. And this is the last question. I know I'm close on time. Thank you for staying with me. Okay, so is there a problem to the bone density for drinking coffee every day? Great question. I love this one. How much can I drink in a day? Do you like coffee as much as I do? So coffee and bone health, the relationship, it's complicated, unfortunately. All right, so caffeine's effect on bones when you consume 6 cups of coffee a day may be detrimental. It may increase the loss of calcium in the urine. So if a calcium deficiency occurs, then we know there might be some bone compromise, right? So that's a little concerning. Caffeine also may decrease the absorption of calcium in the body. However, studies at this point in time, we don't see that caffeine has any influence on the risk of bone fracture. So that's sort of reassuring, right? Now, here's the thing. It's complicated, right? So it's again about that balance. So if you're taking in enough calcium, you probably don't need to worry about the caffeine at all because you're satisfying your goals. And remember, it's about 1,000 to 1,200 milligrams a day. Now, if you see here, what happens is a cup of coffee, you might only lose calcium absorption by 4 milligrams. That's like a drop in the bucket, right? That's really nothing to be too concerned about. But if you drink your coffee like I do, and you'd like to add milk or a creamer or an alternative that has calcium added to it, it offsets the loss of the calcium because you're taking some in, right, in that whole package. So now you see like the bigger picture, and it really takes away that pressure, that worry that coffee or caffeine is bad for the bones. But still, we want some bottom line guidance on this, right? So here's the chemical structure of caffeine, just for your information. And smart coffee consumption essentially really should read smart caffeine consumption is 400 milligrams per day of caffeine. And I just wanted to list a few choices in our diet where we find high levels of caffeine. Okay, so more than a cup of brewed coffee is 100 milligrams. Those coffee shop drinks, they are notorious for being very high in caffeine. And same goes for energy drinks. So sort of just do a self-assessment and do you need to have a little bit less? If you want to translate this caffeine amount, this 400 milligrams of caffeine to coffee, it's about 2 to 3 cups per day. That's what the experts suggest in terms of safe coffee consumption and bone health. But keep in mind that balance, right? So include adequate amounts of those bone building nutrients. And this is my last slide. I wanted to give you a bonus. Too bad I'm not in the kitchen. I should be probably for this. This is an interesting study that was published in 2016 and really got my attention. The researchers took postmenopausal women, and a good number of them, like thousands, and they had osteoporosis. And they assigned them some homework to do for an entire year. They said, you have to eat 5 to 6 prunes per day. Well, guess what happened? It actually reversed their bone loss. Now, 5 to 6 prunes per day, that's kind of a lot in my opinion, but fascinating information and something to think about. So I wanted to include a recipe for you that might incorporate prunes. I'm kind of a purist, like I would just eat prunes as is. But if you wanted to try this energy bite recipe using prunes, it's delicious and a great way to add this package. That's what's in prunes. It's a package of bone protecting nutrients. So we see it's something to consider. Now I included here the citation for the research study if anyone's interested. Okay, I'm going to stop my share and see if there's any